Today, we're diving into a landmark study from the Lancet. It gives us the most detailed map ever created of the physical side effects of antidepressants. This isn't just about whether a drug works, it's about understanding its hidden physiological cost.
When we prescribe these medications, we're treating the mind, but it's the body that often has to deal with the consequences. And while these drugs are absolutely effective, these physiological side effects are a huge reason why people stop taking them. The problem until now has been a real lack of a comprehensive, head-to-head comparison of how these different drugs impact our bodies.
So here's our game plan for this explainer. We'll start by looking at the massive scale of this study. Then, we'll dig into the findings in two key areas. First, weight and metabolism, and second, the cardiovascular system. And most importantly, we'll wrap up by looking at how we can turn all this data into smarter, safer decisions in the real world.
Okay, first things first, let's get a handle on the sheer scale of this research. To build this physiological map, the researchers undertook the largest analysis of its kind ever done.
And this is the number that gives this whole study its power. Over 58,000 participants. When you have a data set this massive, it gives you an incredible level of confidence in the findings we're about to walk through.
So, all this data was pulled from 151 randomized control trials and another 17 FDA reports. It covered 30 different antidepressants, all compared against a placebo. That is a rock-solid foundation, and it's what lets us compare their physiological risks in such detail.
Now, what's brilliant is how the researchers visualized all this. As we go through the results, just remember this simple key. Red means an increase or a risk, think weight gain. Blue means a decrease or a potential benefit, like weight loss. And gray is neutral. It's a really powerful and simple way to see what's going on across the 15 different parameters they measured.
All right, let's get right into the results, starting with something that's a huge concern for so many patients: how these drugs affect our weight and our metabolism. The effect on body weight is just incredibly polarized. It's like night and day. On one end of the spectrum, you have agomelatine, which led to an average weight loss of almost 2.5 kilograms. On the other extreme, maprodoline caused an average gain of nearly 2 kilograms. That's a 4-kilogram swing between different options, which is a massive difference clinically. So this leads to a really critical question. If a drug helps a patient lose weight, does that automatically mean it's safe for their metabolism? The data here suggests we really need to be careful with that assumption.
And the data gives a pretty clear answer. No. This illustrates a crucial paradox. You've got drugs like paroxetine, duloxetine, and venlafaxine, which can actually help reduce body weight. But at the exact same time, they're associated with increases in total cholesterol and, in the case of duloxetine, an increase in blood glucose. This means a drug that appears to be slimming could still be metabolically harmful.
Okay, now let's broaden our view a bit and look at the cardiovascular system. We're talking about direct impacts on the heart, the liver, and more. The variation in how these drugs affect heart rate is just staggering. On one end, fluvoxamine was linked to a decrease of about 8 beats per minute, but in stark contrast, nortriptyline, an older tricyclic antidepressant, increased heart rate by nearly 14 beats per minute. That's a differential of over 21 beats per minute. That is a huge difference in the amount of stress being put on the heart.
When we look at blood pressure, the risks are very specific to the drug. The clearest signals for an increase in systolic blood pressure come from amitriptyline, levomilnacipran, and venlafaxine. For diastolic pressure, mapertylene and levomilnacipran show the strongest link to an increase. And interestingly, nortriptyline is a bit of an outlier, actually reducing systolic blood pressure even while it's raising heart rate.
The study also flagged some signals for liver stress. The class of drugs known as SNRIs, specifically duloxetine, levomilnacipran, and desvenlafaxine, showed the strongest connection to elevated liver enzymes. Now, the average changes weren't huge in these short-term trials, but the fact that the signal is so consistent points to a clear pattern of physiological stress on the liver.
So, what about the risk for electrolytes or arrhythmias? Well, in the controlled setting of these trials, there wasn't much evidence of significant sodium problems or dangerous QTc prolongation. But, and this is a really important but, these trials often exclude older patients or people taking multiple medications. In the real world, the risks of issues like hyponatremia or arrhythmias could be much higher for those vulnerable patients.
Okay, so let's consolidate all that. This chart does a great job of grouping the high-impact drugs. In the top left, we've got the agents with clear hypertensive signals. Top right, you have the multi-system offenders, like the tricyclics, that affect several things at once. Bottom right are the ones with specific signals for liver stress.
And then, crucially, in the bottom left, you see the agents with a lower overall physiological footprint, including agomelatine and many of the common SSRIs.
This brings us to the most important part of all. How do we take this massive, incredible data set and actually translate it into smarter, safer clinical decisions for our patients?
The analysis found some key predictors of who's most at risk. Patients who started with a higher body weight were more likely to see increases in their systolic blood pressure and liver enzymes, and older patients were more susceptible to a rise in their glucose levels. This tells us that the physiological cost of picking the wrong drug is simply higher in these specific groups.
And these aren't just abstract numbers on a chart. They translate directly to real-world risk. Let's just use amitriptyline as a concrete example. The study shows an average 1.6 kilo weight gain, a 9 beat per minute increase in heart rate, and a 5-point rise in systolic blood pressure. When you consider other data showing that every single beat increase in resting heart rate is linked to a 3% higher risk of death in older men, well, you realize these seemingly small changes add up to a very significant increase in risk.
So the crucial takeaway is that we need to shift our practice away from one-size-fits-all and move towards physiological profiling. This study gives us a clear 4-step framework. First, assess the patient's baseline cardiac and metabolic risk. Second, select agents, and just as importantly, avoid certain agents in those high-risk patients. Third, monitor key labs for specific drugs, even if weight seems stable. And finally, step 4, personalize the choice, prioritizing drugs with better metabolic safety when that's what's needed most.
And that brings us to the ultimate take-home message from the study authors themselves. Precision medicine must include physical health. The choice of an antidepressant should no longer be based on mental symptoms alone. It has to be a careful, individualized balance between the patient's clinical presentation and their own unique physiological risk.